Social justice analysis. Closing the gap. Nursing's path. The path of nursing continues to push for patient rights and improve health equality, especially amongst health disparities. The ANA's updated Code of Ethics for Nurses with Interpretive Statements appropriately addresses the concerns of Beckmeyer and Butterfield. Beckmeyer and Butterfield felt the ANA's previous guidelines did not make nurses accountable for their potential part in health promotion, prevention, and leadership in the healthcare field. Provision 8 of the Code of Ethics for Nurses explains collaboration between the nurse, other healthcare professionals, and the patient. In it, the ANA states, quote, "Nurses collaborate to address barriers to health, poverty, homelessness, unsafe living conditions, abuse and violence, and lack of access, by engaging in an open discussion, education, public debate, and legislative action." Unquote. While it may not be stated as a direct reply to Beckmeyer and Butterfield, the similarities between the complaint and the updated provision are there. Other areas of concern addressed included community involvement and the growth of nursing, leading, serving, or mentoring on policy committees, and specifically addressing social justice in nursing. Nurses need to know that they are the voice of healthcare for the future. Reforming healthcare. Nurses have a voice in healthcare changes and can make a difference. Farmer wrote in 1997 that those who are at a disadvantage financially are also at a disadvantage medically. However, we've come a long way since 1997. While this is still very true today, nursing has grown from this. The implementation of the Affordable Care Act gave those previously who were not able to afford health insurance the ability to do so. Mary Wakefield, who was the Administrator of Health Resources and Services Administration during the initiation of the Affordable Care Act, sought to make health disparities non-existent and close the gap between the poor and the wealthy in terms of health reform. She, like many others before her, showed nurses can be a leader in legislative issues and help change unfair health advantages. The ANA states that nurses need to be leaders on both their community and with legislature issues. If I'm not able to make a difference for my nation, I can still make a difference for my community. On a smaller scale, I can volunteer at a free local clinic to help provide accessible health care to those who would not be able to afford it otherwise. I can also help with local research into other causes of disparity, such as race and gender, and work to help fix these issues. Distributive justice. Healthcare should be available to all. When people think of distributive justice, they think of equality in all aspects: money, food, goods, etc. But what if we could provide this in just one of those areas and effectively make it a more even playing field? Van der Heyden describes distributive justice as, quote, goods, unquote, and, quote, bads, unquote, should be distributed amongst all people, making them equal. Healthcare should not be something one has to decide as worth the sacrifice financially. It should be available to all without the stressor of how one is to afford it. Oftentimes, the poor wait until they are so sick that someone has to make the decision for them. If you don't think this affects you, you are wrong. The Henry J. Kaiser Family Foundation states that healthcare costs taxpayers $2.6 trillion. That is approximately $8,000 a person. If healthcare was appropriately accessible by all, healthcare costs could be significantly decreased by allowing those who are inappropriately served to have earlier intervention. Health is a basic human right. Equality is often confused with equity. Equality is where everyone gets the same care with the same access. Equity is where everyone gets care depending on their specific needs. You wouldn't want to give blood pressure medications to a person who does not have high blood pressure, but you would to someone who does. Healthcare needs to be a blend of both equal and individualized care, and it should be available to all. The ANA Code of Ethics describes how nurses have an obligation to be involved in these changes. Nurses need to see patients as people, not as the label society gives and separates them with. Nurses are often their patients' only advocates. This needs to start with the ability to access the care they deserve. Where do we go from here? Well, we need to focus on what we can do as individuals. In conclusion, nurses have an active role in overcoming the shortcomings of America's healthcare. The ANA appropriately addresses these concerns in its updated code of ethics. Nurses are often overwhelmed with the large-scale problems of the country and do not realize they can make a huge impact on their very own communities, and if they wish, grow from there. Reforming healthcare cannot be done by a single person. It takes several people with the same goals and attitudes. We need to focus on making healthcare a right rather than a privilege. The part nurses play in distributive justice is very well defined. Nurses are the backbone of the healthcare system. It is up to us to make sure we are sparking the fire to move things forward. Everyone deserves equal care when it comes to their health. It should not be limited to only those that can afford it. Thank you for allowing me to present this to you today. I hope you found it useful. Please feel free to ask any further questions below on my discussion board post.